Welcome to Phase 4 of the InBrace Fitting Appointment. In this video, we discuss the procedures following the bonding of InBrace brackets. Now that all brackets are bonded, thoroughly rinse and then remove the NOLA dry field system. For added comfort, rinse with water before removing the NOLA. Check for any tray material left behind or adhesive flash and remove it using a scaler, explorer, or a finishing burr. Now, check all interproximal contacts using dental floss. If found, remove the adhesive flash using a scaler, burr, or a serrated strip. Before inserting the Smartwire, check the treatment instructions to determine if any interproximal reduction, or IPR, should be performed. Alright, now you're ready to insert Smartwire 1. To start the insertion process, select the lingual Weingart pliers and lightly grasp the neck of one of the lockets on the Smartwire. Then deliver it to its appropriate bracket on the arch. Insert the locket at a 20 to 30 degree angle of approach until it rests passively in the gingival tab of the bracket. During insertion, use the legs of the locket to help guide it into position in the gingival tab, especially when a tooth is rotated or misaligned. Before moving on to ligation, make sure that each leg is resting correctly along the mesial and distal sides of the gingival tab. Ligation requires the Smartwire engager instrument. Notice the tip of the engager instrument is designed with a V that corresponds with the purchase point located on the neck of the locket. Now this is important. Before pushing down on the neck with the engager, make sure you're holding the tip of the engager at the correct angle. When held correctly, the tip should be centered and parallel with the long axis of the bracket. If the tip of the engager is angled to the left or to the right, it may push the neck against one of the two occlusal tabs, and that increases the amount of force you'll need to ligate the Smartwire, and it might even prevent ligation altogether. Here's a couple of tips that may help you find the correct angle. First, adjust your seating position so that you have a direct occlusal view of the bracket, the tip of the instrument, and the neck of the locket. Then you're able to see if the neck is centered between the two occlusal tabs. Second, use the engager to gently rock the neck of the locket back and forth in a mesial distal direction until you feel the neck is centered and ready to be pressed down to complete the ligation process. When the tip of the engager is oriented correctly, press down at about a 30 degree angle in a gingival, slightly labial direction. The gingival force will compress the locking spring until the shoulders pass underneath the occlusal tabs on the bracket, where they're held secure throughout treatment by the positive pressure of the locking spring. When Smartwires are ligated, you typically hear an audible click when the locket is ligated. Now, repeat this process for the rest of the brackets that are bonded at this time. Here's a clinical pearl. Once the first locket is ligated, you can speed things along by inserting more than one locket at a time. Just insert several lockets so they passively rest in the gingival tabs of several brackets, and then use the engager to ligate them, all in one sequence. When all lockets have been ligated, the final step is to push labially on the neck of every locket using the engager. This confirms all lockets are securely ligated. When doing this, if you hear a click, that means the locket wasn't ligated under both occlusal tabs on the bracket. Taking a few extra seconds to confirm ligation prevents unwanted tooth movement and keeps treatment progressing as planned. With Smartwire 1 inserted, it's time to address any blocked out teeth. You have three options. You can direct bond a bracket off center. This is typically done during the bonding phase. You can directional bond the locket to the tooth, or just leave the locket as is. The next step is to check for occlusal interferences. At the doctor's discretion, place flexible anterior bite turbos or posterior bite turbos to open the bite and prevent collisions with the upper brackets. Now that you're at the end of the fitting appointment, ask patients if they feel any discomfort and resolve it using a comfort product. Well, this completes the post-bonding phase of the fitting appointment. By closely following these steps, your team, and even more importantly, your patient, will benefit from a consistent wow experience at each and every fitting appointment. Oh, and one last thing. Use the 4 fitting checklist guides found in Knowledge Base on the Smile Design Studio for a helpful chairside reference.